As a nationwide indefinite strike by medical doctors in the public hospitals in Nigeria enters day 19, the Minister of Health, Prof Onyebuchi Chukwu, has again appealed to the striking doctors to please go back to work. In an interview with our correspondent, Yomi Otaigbe, Professor Chukwu said the federal government has made efforts to accommodate most of the demands by the doctors.
Government signed an initial MOU with the NMA on the 26th from a meeting that started on the 25th. Both parties signed, so we thought that was a good agreement, but they reneged on it and insisted they would go on strike. Government being backwards, sat with them again for 10 hours, making a total of 24 hours. Another MOU was signed, and we thought, okay, now, thank God, this was all over. And again, they've reneged on it. I think it has to do with this rivalry, as it were, with a non-physician group in the health sector, which I think is unfortunate. We are still working with them. And honestly, with the government is actually showing a lot of patience. I know governments can't also go beyond a certain period. If government keeps being pushed to the wall, I'm sure they will bounce back. But I think we are trying to not to get to that level. So I'm still pleading with my colleagues, the doctors, go back to work. Government is attending to your needs.
As the Minister of Health, Professor Onyebuchi Chukwu. Now, the neglect of maternal mental health challenges and widespread stigma of mental health illness, especially in low and middle-income countries, have been identified as some of the clogs in the overall health of people living with these conditions. Nigerian physicians based in the Americas who highlighted these factors have specific recommendations on how to address depression, mood disorders, and other maternal mental health issues. Our health correspondent, Yomi Otaigbe, reports from Southern California in the United States.
It's a significant meeting as this marks the 20th anniversary of the Association of Nigerian Physicians in the Americas. Although thousands of miles away from home, these doctors are looking at global health issues, linking them to the Nigerian situation. Here, maternal mental health disorders are on the front burner.
If you looked at the data that is available, there seems no doubt that there is a higher prevalence of maternal mental health disorders in low or medium income economies compared to high income economies. So for example, in the UK, most of Europe, and perhaps the States, you're talking of about an incidence of about 10%. The few data that's available from Africa suggests that it's as high as 20% or 30%.
A lot of different factors that are associated. Biological factors are one of the main ones, and even though genetics has been touted as polygenic, so it's not a direct progression. So if your mother had a mental disease, you may not necessarily have a mental disease.
Poverty is a major cause of depression. Poverty is a major cause of many psychiatric illnesses. The issue of stigma and discrimination is a difficult problem to crack, but these two issues have to be faced.
Nigeria's Minister of Health is a special guest, and he acknowledged that mental health is not being promoted as much as it should in Nigeria.
When those in mental health have been talking since we have been here, I could reason that yes, we need to make noise. The gynecologists make so much noise. That's why everybody is talking about maternal care. We need to make the same kind of noise, even in surgery, even in anesthesia, even in mental health.
For the speakers, Nigeria can borrow from these recommendations.
One of the key interventions obviously has to be community-based. There is a need for good quality research that actually describes what the problems are. There is a need for efficient organization of services that actually promote maternal psychological health.
So many people are being left behind, and the mental consequences are unimaginable. The bigger countries like in the US and Britain have put a lot more into mental health care. So we decided that we needed to bring some focus to mental health, especially in Nigeria.
So much on mental health issues. Discussions will continue tomorrow, and this time the focus will be on healthcare partnerships in Nigeria. From the 2014 annual meeting of the Association of Nigerian Physicians in the Americas, holding in Anaheim, California. Yomi Otaigbe reporting for Channels Television News.